Hi, I'm Sophia Mazzetti. I'm a public health professional. I'm here today with the other members of our research team, Dr. Brooke and Dr. Liming, and we're here to talk about the final section of our survey, which is on social determinants and drivers of health and racial equity. So what we really wanted to look at with this section of the survey was, first off, are agencies aware of social determinants of health and racial equity issues, and what level of awareness do they have? And, following from that, are they documenting, racial equity in access and completion and, social determinant of health access issues? And then not just are they documenting these known issues, but also are they able to track who they're not necessarily able to serve, those populations that might be underserved. So we did this via both quantitative and qualitative questions. This is a graph sort of summing up 10 quantitative questions, looking at what factors agencies document. We had 61 respondents, and we asked them, okay, is your agency documenting this factor consistently? That's the dark green. Are they doing it inconsistently, light green? Or are they not collecting it at all, which is in orange? And then, are they not collecting it now, but maybe it's a priority for you all and it's an area you want to start collecting in the future? And that's in yellow. So right off the bat, this is a really great, it's a great chart just because it shows not only is everyone, is there no category that isn't being documented? If you look at the agencies reporting that they're documenting both consistently and inconsistently, not a single factor here is documented under 50% of respondents. So like right here, this is the lowest category, access to caretaking support, and that's right around 64% of respondents said their agency was documenting it, and so that's really impressive. Within this really high level of documentation, there are some variances. So, for example, access to care is very clearly a priority. You can see that 71% of respondents said their agency was documenting it consistently. Another 21% said, they weren't documenting it consistently, but they were doing it at some point. And so all told, that's, over 90% of respondents saying that their agency was doing some level of documentation for access to care. And so that's, great. Access to non-English services here is another, very clear, big priority. On the flip side of that, access to caretaking support was not necessarily as consistently documented as a lot of other categories. The same thing for access to gender affirming care. And then one other area that I'd like to draw your attention to is this yellow. We're not documenting this now, but maybe we will in the future as sort of an indication of an agency's priorities or what they hope to move towards. And in this area, racial equity in service access and racial equity in service completion are both highlighted as very important. 21% for service access and 26% for service completion responded that it was a future thing to document. And so that seems to be a really important topic and an important area of growth for these respondents and their agencies. So in addition to the individual factors, we also wanted to see, when looking at value-based payment and the implementation and the training and the system in general, is the agency able to evaluate the populations that, they might be failing to reach or underserving? And around 41% said yes. And that's, to me, that's hugely impressive. Around just under 50%, 49% said they weren't sure whether or not their agency was able to evaluate this. I do want to say in regards to that number, around 43% of our, of the 61 respondents said that, they were either currently in VBP training or they hadn't even started VBP training. And so a certain level of that may just be due to the novelty of the VBP system. So transitioning to the qualitative questions now, overall, there was a really strong sense of, gratitude and appreciation towards the Community Mental Health Fund for focusing on these issues and focusing on, racial equity and social determinants of health in general. And it was also made clear that this was very much a priority for these agencies as well. You can see, here's someone outright saying this is a priority for us. But it was also something that it was very clear it was a work in progress, and different agencies were at different stages. Some of them were still planning, some of them were implementing and executing those plans, some of them were struggling with research. And so what we heard consistently was, different agencies are at different stages. And there seemed to be a disparity among the agencies about what access consisted of. In addition to those pieces of feedback, we also heard a lot, and we discussed this in the previous sections, but we heard a lot that, staffing shortages and a lack of capacity have been major roadblocks into, implementing and improving some of the changes these agencies would like to make. And they'd really appreciate support, both in terms of, actually being able to analyze this data and, figuring out what the best practices in this domain is. So I want to end it off with a couple of quotes that I really enjoyed from the qualitative responses for this section. To what extent are we working to connect social determinants of health to racial equity issues? We need to be doing this work. CMHF is our thought partner. We need them to help us think about how to work on this. Thank you so much for listening.